Just open them all now.
Okay, there we go. Good evening. Today is Tuesday, September 27th, and the board meeting was called to order around 5:20 p.m. today, with the board going directly into executive session under ORS 192.6602D to conduct deliberations with persons designated to carry on labor negotiations, and ORS 192.6602H to consult with counsel concerning the legal rights and duties of a public body with regard to current litigation or litigation likely to be filed. It is now 6:06 p.m. and we are reconvening our meeting with the public session, which is a work session. We have Director Bethel is absent this evening, and we have Director Hyen on Zoom, and everybody else on our board is present. Today is a very sad day. We heard about the loss of our West Salem high school student, and our hearts are incredibly heavy with Zachary's family, and as a board, we have an incredibly heavy heart. I do want to draw people's attention to a really nice post that is publicly online from the family of Zachary, and I just want the community to hear some pieces of that. This is from Brian Brenneman. Thank you to everyone, family, friends, our communities. From the moment we were aware of Zach's disappearance, we were shown tremendous love and support. We are deeply saddened to update that Zach passed away on September 16th. We are heartbroken and request privacy as we grieve. We are aware of and had open discussions regarding Zach's gender identity. This was an ongoing process that Zach continued to question with us and himself. If Zach had asked you personally to use different pronouns or names, please continue to do so. And then they go on to thank the Salem Police Department and Detective Kirksey for working nonstop from the moment that they found out that Zachary was missing. I'm now going to turn it over to our student advisor, Isaac, who is a West Salem student.
Thank you, Director Cottingham. Today, the Titan family has a heavy heart, and we are grieving. The crisis team has been at West Salem today, and the students in our halls are somber. There are students who are very close to Zachary, and for their closest friends, this is extremely hard. We appreciate the support of additional counseling staff. We knew Zachary as a courageous student who was not afraid to be their authentic self. They will be missed. Our hearts go out to Zachary's family. Please join me in a moment of silence. Thank you. I would also like to share and highlight that the district crisis team will be in the West Salem High School library to offer any support to any students at West Salem who need it. And again, highlight something that we highlighted in last meeting is the resources on the back of the student ID cards. I can pull that out real quick just so I have the accurate information, but some emergency contact info for any students. I think the suicide hotline, and any bullying or threat of violence, and Safe Oregon. So just want students to remember that there are resources at their fingertips on their student IDs on the back of them.
Thank you, Isaac. Next, we have our diverse welcome message. Buenas tardes, good afternoon, welcome and bienvenidos to the Salem-Keizer School Board meeting. At all times, whether we meet in person or virtual as we are tonight, we strive to be inclusive, respectful, and welcoming to our students, staff, educators, administrators, board members, and all community members. We welcome people of all genders, people of African descent, Black, African American, Asian descent, Arab descent, European descent, those who identify as Hispanic, Latinx, people indigenous to this land, and people of mixed and multiple descents. Languages spoken in our communities are welcome. Spanish, English, indigenous languages, sign language, Chuukese, Somali, Russian, Chinese, Vietnamese, and many more. People with disabilities, visible or invisible. People of all religions, believers in all faiths or creeds. Gay, lesbian, bisexual, heterosexual, pansexual, transgender, queer, two-spirit, or others for whom none of the labels fit. Survivors, your emotions, joy, bliss, grief, rage, indignation, contentment, disappointment. Your families, genetic and otherwise. Our veterans who proudly served and who are currently serving our country. Our elders, those here in the room, in our lives, and those who have passed away. People impacted or displaced by the war in Ukraine and other violent conflicts. Yes, and finally, we would like to welcome the ancestors who lived in this land where we live and work. Welcome to the spirits of the Santiam, Kalapuya, Siletz, and Grand Ronde, the natives who lived in this area before the Europeans came. Welcome and bienvenidos. Now please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I do not believe there are any agenda modifications this evening. And so next we're going to move to talking about our board goals. So just as a quick recap and reminder, we started off in the summer talking about priority areas. All of the board members were able to share ideas, concepts, issues that they really wanted the board to focus on for this school year and beyond. And so we took all of those thoughts and compiled them, synthesized them into five goals. And then under each goal, you will see how we essentially plan to achieve that goal. And so I think at this point, if we could pull that up, if it's easy, Assistant Superintendent Dusner.
And I thought I
Post
had
notes on?
made, yeah, I thought I had made you
Pardon me?
copies of the goals, but you're going to want to go to your agenda.
Online?
the
Okay.
Online item. I thought
Okay.
I had made copies for you.
And we can pull it up on the screen, so that's,
If you go to the website, it's in the agenda packet too, if you go into your calendar invite.
yeah, it's listed as supplemental materials on where the board agenda is posted for the public, if you want to follow along. Okay, so the first goal, goal 1.0, is to equitably improve the academic performance of students. I'll just read the goals first while we're getting everything queued up on the screen. Goal 2 is to equitably improve the physical, mental, social, and emotional health for students and staff. Goal 3 is to equitably improve the conditions and systems that lead to safe and welcoming schools for students and staff. Goal 4 is to equitably improve board governance through policy updates and accountability structures. And goal 5 is to equitably facilitate authentic engagement. Oh, we're having some feedback.
It happened right when they hit share screen, so I don't know if they had.
It's not sharing right now.
Say something.
Test?
Are you muted when you shared your screen?
Yeah, I'm muted. And my mic's turned all the way down. Levels are turned down. The second I hit
Test.
share-
Okay, why don't we take a 5-minute recess to try to figure out our tech challenges? So we'll be back at 6:20.
Your screen sharing, Econ? No, not yet.
But the second, it might have been coincidental, but the
Yeah,
second I
open all
hit
snacks.
share, it came up, when the
Okay, I believe we are back. It is now 6:20. I think we've solved some of our tech issues, hopefully. So we'll go back to goal 1, and we're just going to walk through the strategies and have a board discussion around these strategies and clarify exactly what we want to do for each of these, set timelines where appropriate. Feel free to jump in, and discuss anything that pops up related to this goal-setting activity. We really want to set our strategic vision for the school year, as soon as possible. We understand that many of these strategies and items will go beyond this school year, and we hope they will remain relevant. We know almost everything we have on here is critical and important to focus on. So it's just a matter of refining it as we go to improve student well-being and outcomes. So goal 1 being equitably improve the academic performance of students. So the first strategy that we've laid out is to learn and deeply analyze our key performance indicators, or KPIs, which we've talked about quite a bit in this boardroom, and then look at the state assessment data and then any other data available to be able to assess student performance as a total system. And so the foundational work related to this strategy, which I feel is critical to achieving goal number 1, is to do a learning session with the board in October. And that is where we would do the deep dive into the recent data that was released from the state, which I think everyone is concerned about, statewide, nationwide, et cetera, around setbacks related to the pandemic. Director Hine, I see your hand up.
Thank you. Yeah, I just wanted, I understand why you're using equitably in the 1.0 title. I just want to be sure that we really want to improve the academic performance of all students, and I don't want that to get lost.
Yeah, of course. I agree. Okay, so at this, I was going to see if Christy or anyone on your team, Superintendent Perry, would like to just, in case there's a lack of knowledge, I find this confusing because we have so many different streams of data that are assessed in different, they're gathered in different ways, assessed and used differently. And so do you want to just do a brief overview of what we mean when we're talking about what we plan to do in this learning session?
So our goal at the end of October, and we're thinking about this as the next work session, is to kind of walk through, here's what our KPIs are, here's why we think these are important to measure, to monitor the health of the system, and here's what our state assessment data, and then we also want to look at to show you kind of how we also track some longitudinal data of our students, because the students in Salem-Keizer come in way below the state average, but by the time they get to 11th grade, they're above state average. And so we kind of want to look at all of that, and we want to say to you, here's where we are, here's how we think you should measure the health of the system. We're going to do the KPIs regardless, but you might also then say, we think you should consider a different KPI. And then we'll spend that time just doing that kind of deep dive into the data. Here's where we get our information. Here's the sources. Here's what we can easily put onto a dashboard. And then help you set either targets from there or what you might want moving forward in the form of reports. And so we thought that would be a great kind of grounding exercise now that we have our first year after the pandemic of the state assessment data too. So that's how we're shaping up the work session in October around academic achievement. And we think that's really an important place to launch right after you've gotten your goals almost finalized, that we really center our work around academic achievement.
Director Chandragiri.
Thank you very much, Chair and Superintendent. Of course, we all are concerned nobody, without a doubt, we are concerned about the ODE, and it shows that with the pandemic, etc., we have lost some grounds. But there are some historical trends that some of the communities who are left behind are even further left behind. So if you kind of go back and look at the data, so, and pretty much every community is affected, everybody is left behind. So the question is, when we take that and understand what should be an ideal benchmark to which all communities should be reaching, is there a way for us to have some kind of measurable, quantifiable numbers saying, 90% of them should reach this level? A community A is at 60%, somebody else is at 30%. So how are we going to use some steps to remedy, whether mentoring, tutoring, etc., in a differential way, so that everybody gets to 90%? Because
Right.
because otherwise this shows to me like a process measure rather than
Right.
a clearly measurable outcome measure. Parents are interested in seeing how can my child get to the 90th percentile as
Yeah.
opposed to understanding and still be lagging behind.
Yeah, I agree, Director Chandragiri. I think, so what I want to do is go through all that baseline data in that work session, so you will know where we are when we review that data. Like, we will know third grade English, fourth grade math, like baseline. And we'll have the data broken out demographically too for that state assessment. And then we can have that discussion on what do we want the overall increase to look like, what's doable so that everybody achieves that measure. Like, that would be, using our equity lens, we would have to focus even more on students that have been historically marginalized to get to that overall higher benchmark. But we could have that discussion about the number we feel is the board wants to push for, with the district saying, yes, that's achievable, or that's going to be hard to do in 1 year, but we might be able to do it in 3 years, something like that. So that's the level of granularity that I'd like to get into in that work session. So the strategy is to learn, then we set the benchmark.
So do you mind if I ask a clarifying question? So when you say goal, this is more like an aspirational, it's kind of a very broad thing. It is not like a goal in the sense, I want my patient's blood sugar to become 100, or I want our children to reach 90% because that's the
Satya,
state benchmark.
Marty
Okay.
can't hear you.
What I'm trying to understand is when you say goal, it is too wide. It's like saying everybody will do well or everybody will study well. But it doesn't really, as a parent or a community, we want to know, okay, does this mean my child will graduate or within so many years, or 90%, or whatever it is? Can we be a little bit more measurable goal, and then we can say these are the strategy we will use to see the difference?
Okay, so my understanding of strategic planning, Director Chandragiri, is for a board like ours to set aspirational goals, such as we want to improve all academic performance. And then parents and others would be able to see the measures embedded within that goal and track progress towards achieving the ultimate goal. So if we were to set goals that had a measure embedded in the goal language, we would have like hundreds of goals. So you have to have something that rolls up to the aspirational goal in a strategic plan.
I think 1.2 gets to, what do you think? Strategy 1.2, like, maybe
Yeah,
your
so
mic
it-
gets more to what?
Yeah, go ahead, Director.
Sorry, I was just saying, strategy 1.2, which reads proposed revisions and updates to KPIs and results policies and sets performance targets and accountability structure with timelines, gets more to that piece that you're speaking of, Director Chandragiri, right, of what are those performance targets, and we get to revise the KPIs and the results policy, which we've discussed for some time now. So that is part of the aspirational goal, just like Chair Cottingham mentioned.
Sorry if I'm not understanding, Director Chandragiri. So how would you rephrase or reword goal number 1?
Well, you know, as a parent, I'm just looking from a family point of view. We take the kid to school, and you could say something like, our children, based on your summative test or what are the tests that schools give, they will reach 90th percentile. Because when the state puts out the scorecard, they always refer to the benchmark, and then they say where we are. That's the way the ODE always releases every year. So as a parent, we are looking at that state benchmark and saying, why is this community not reached that? So to me, that is an example of a measurable target that community can. For example, African American community or Hispanic community. Then we can say that, okay, what would it take? What kind of investment it would take to get that children from Hispanic community to reach 90th percentile, which is the state's benchmark. So that is already there. Rather than we recreating a new benchmark, state as ODE always puts out in their scorecard. Why can't we use that as a measurable target and see what kind of extra investment we make for, say, children from Hispanic community or Black community or recent arrivals?
I think that's exactly what we are saying. So
Yeah.
we would look at that, whatever benchmark the state has set,
Okay.
look at what Salem-Keizer, how we measure up, and then set expectations for the district around what we want to achieve. I mean, obviously, we want to have the highest performing schools in the state, but if, it's, what's a reasonable expectation to put over a certain length of time on the district related to that data. Also, my understanding, which I think we'll talk about, is that sometimes the state assessment data isn't the best measure of where we are today because it's a point in time last year, last spring, and the key performance indicators are more in real time, and the district is more able to make like micro adjustments throughout to address some of the inequities I think you're raising, Director Chandragiri. And so in that discussion, we may want to focus more on KPIs. We may not, but we may, and say, the district has set this key performance indicator with wanting to reach this benchmark. And the board, like you, I remember very specifically in our planning session, you wanted more improvement, for an example, in like third grade reading, right? So that would be the time where we would say, here's what the data says on third grade reading, and I want it to go up for everybody 2 points or 10 points or whatever you're feeling when we have all that data in front of us.
All right. I mean, it's a good start, but we have had this language, which is not measurable goal language in the previous iterations of our result policy, etc. I believe it is 2017 result policy is an example where they really talk about measurable goals. I think having a measurable SMART goal would be something that will hold the board accountable, will allow us to hold the district accountable, will allow us to make targeted investments during the budget time. And a good example is when the DLI resolution, when we passed, we said so many schools every year till 2027, we'll have all 21 schools achieved. So that to me is an example of measurable target for implementation. That still doesn't talk about the outcome. That's where you need to eventually have a different saying, are those kids reaching 100% graduation or 90% graduation? So what we are talking about are something from a family, and the community is looking for something that they can tangibly hold onto, saying, I take my child to this school. Is he going to graduate within so many years? Or is he going to get proficient in third grade English? Or is he going to be lagging behind? That's how I am seeing. So we can give them more tangible, measurable goals so they can hold us accountable.
Well, and I mean, based on the timeline that we have here, we put that we're going to have more tangible goals after we review the current established data, hopefully in January 2023. Marty's been waiting very patiently.
Go ahead, Director Hyen.
Thank you. So one thing I always have to remind myself of, this is really more for me and maybe the public, because I used to be a database administrator and we dealt in details, and details were very important. But as a board member, what we're defining, of course, is what is the goal and not how to do it. How to do it is up to Christy and her staff to figure out. And for me, it's kind of like sometimes I want to try to fix it. So I have to remind myself that's not my job. In fact, I could cause problems by trying to do that for the district. And then I have a question is if as we change some of these goals, are we going to roll them into executive limitations?
Yeah, that's a good question, Director Hyen. I think we will get there. If we can keep going through some of the strategies, maybe it'll become more illuminated sort of how we plan to achieve the goals. So I will just keep going through that we, as Director Hinojosa talked about, we would revise and update Director Guzman-Ortiz. Actually, both of you, I think, spoke to 1.2, and set performance targets and accountability structures that would be woven into the executive limitations work. So, first, my sense is that our entire board at this point doesn't have a full grasp, nothing wrong with it, of the data that's in existence or, sort of where we are, baseline. And so that's what we would do in October, is do that level set of where everybody stands. There'll be demographic breakdown, grade level breakdown, and that would kind of set out the work ahead of us. I agree with you, Director Hyen, that the role of our board is not necessarily to operationalize everything, and that's why we worked really closely with the superintendent and her team to make sure that these strategies were in alignment with the sort of separation of powers, and to make sure that they dovetailed nicely with the work that the district's already doing. As you mentioned, Director Chandragiri, the expansion of the dual language implementation, we've set those benchmarks already. So as that strategy is here, we would point to the work we've already done to set out the expectations. So not every expectation is going to literally be typed into this document. It will be in resource materials. We would then create a public-facing dashboard that parents would be able to use with the key data elements that the board agrees upon based on that review of the state assessments and the key performance indicators, as well as feedback from the parents and the community to know that, yes, they will want to go to that public-facing dashboard to look at those things broken down in a particular way so that it's super user-friendly. And then monitor the work of our newly established District Equity Advisory Committee to determine any changes in policy. And we know they're just information. The board role then would be to review the minutes, of that board, review kind of their foundational documents, how they plan to organize themselves. And then up for debate is how do we utilize them ongoing? Like, what things do we want to run by them? What things do they want to send to us? We know the requirement, I feel like, is just an annual report to the board. And so we may want more or to utilize them in a little bit different way. Director Chandragiri.
Thank you, Chair. I really think this is a good committee. And one of my wish, if our leadership agrees and superintendent agrees, is to have this committee take a look at all our board and district policies and completely audit them, because that will give us a fresh set of eyes to see how our policies, whether it is district policies or board policies, when it pertains to students and their lived experience from different communities. So that would be one hope and aspiration I have. And it can start with simple things like safety and discipline policies, or learning policies, or children from Black and Hispanic families are how percentage of them in, say, TAG program or AP program or honors program. So that way they can be the first independently take a look and then give their advice to, because this is a district board, so they have to ideally report to superintendent and hopefully the board can also get a copy of their advice. It's more an advisory board, if I understand
Yeah,
right.
and you're talking about the equity committee,
Equity
right?
committees.
Yeah, part of, they will come to a point in time when they do report to a board, because that's part of what they can do. And at some point, once we get them up and running and they've got to set their norms and everything, that is exactly what they should do, but we also need to let them guide what their first couple steps are a little bit.
Director Hyan.
Thank you. I do like Director Chandragiri's idea that they would audit the policies. I think that's great. The question I have is on add a member from that group to the budget committee. And I know the number of people on our budget committee, I think, is by statute. And I'm just curious if we're adding an additional person. So it would be an 8-member community board or budget committee, or are we going to just only, like, for one person? How are we going to implement that? Are we going to increase it, keep it the same, and just require that one of those people is part of this committee? And is there any legal ramifications to either way? And would they be a voting member of the budget committee?
Let me see if I can get all these. Yes, they would be a voting member of the budget committee. We are not adding more people to the budget committee. It's by the same statute that created us to have that district equity committee that would require us that once that there's a vacancy on the budget committee, that we would have to put forth a person from the district equity advisory committee first.
I see. Okay. Thank you.
Of course. Okay, so any other discussion on goal 1, anything related to achieving equitable improvement in the academic performance of students that you don't see as a strategy here that you want included?
There's a term, data equity, in researching, and that's something we're starting to get into. So I don't know if that's something that we would want to look into, because I think it would go very well with even this, all these goal number 1, and with it, it's additional work that we can look into and discuss later.
Yeah, definitely. I think at that deep dive, we'll be able to talk about some of the issues with, like, what is this data telling us? I mean, I know there's a lot of controversy over, state testing and just in general. So I think it'll be good for us to talk about what the data means to us, and then how which data elements do we feel are most critical and that we can influence improvement in academics without sort of harm in other ways.
Yeah, and we'll be going. I'll be going through data equity training in the next couple months.
Great. Director Chandragiri.
Thank you very much. As Superintendent Dr. Gill from ODE, he said some of the summative tests, which I believe the federal government requires us to offer, because our Title I funds are tied to that, tells more about the system, not about the child. Mm-hmm. And some of the things that we do in school, I believe the teachers do, which they can do different ways of formative tests and adaptive. They can adapt the test, are to talk about how the parent can understand the child's progress. I believe both are important because the system, as Dr. Colgill also explains, that system, we need some kind of way to make sure the system is also responding to different communities. Otherwise, we will be lost and we will not be able to understand why certain communities are left behind, what kind of extra investment is needed in some communities. Those system data we cannot forego because we have to differentially allocate resources for, say, some communities which are vulnerable and left behind. So some of it is for the system, some of it is for the child and the parent and family. That's my understanding. Superintendent, you may be able to explain it better.
That is correct, and I think I know you're trying to center families and parents, but a collective board's job is also to think about the system and the health of the system. So you have to think about how that comes out in terms of your own goals and results policy.
So we need both, right?
Well, technically, as a board, if you were only thinking about your board role, you would want to think about health of the system.
Mm-hmm.
And for us, summative isn't telling you a lot about health of the system. It's a bigger system, but it's telling you one piece of information.
Okay.
For families and parents, down to the classroom level, the classroom teachers and the schools want to be really sure they're telling families about how they're doing.
Okay.
So you think about it in layers. What assessment do we have that tells a family what's going on? What assessments do we have that tells a teacher how do they need to modify instruction? What information do we have that tells a school about how they're doing and how they're setting up their interventions and their groups? What information do we then have as a system to make sure we've got the right people in place? And then what as a board do you do? And it should be different layers.
So, which really is important because could that be embedded as one of the under this goal 1? Could that be how do we train different communities to understand what superintendent just described so that families can understand why it's important? Could that be one of the bullet points that we'll have an authentic way of teaching different communities what those tests mean or how to look for those tests ahead of the test and how to ask their children to be tested if necessary? Because a lot of families can also benefit by understanding and learning those things way ahead of time.
If you want a paper copy, and I'm taking notes too. That's up to you as far as if you want to add that as a strategy. I might suggest that might come under like a parent engagement type strategy in the future. For the health of the system and your role as a board, I would put that one somewhere else. It's not the wrong thing, but it might come next, especially around a public-facing dashboard.
Because right now only Title I we are required by law. For others also they can learn from this if I understand right. So it can be in a different category, no problem.
But I'm jotting down notes too, so that we can weave that in. All right. Any other comments on goal 1? Okay. Moving on to goal 2. So again, goal number 2, as we've drafted it, would be to equitably improve the physical, mental, social, and emotional health for students and staff. We have 3 strategies outlined. So some of this work we've already begun to monitor social, emotional, and mental health supports for access to resources for students and staff. This is obviously really important, and we know the district has spent a lot of time thinking through how we can best support our students and have added a lot of additional resources over the last couple of years. I just want to remind people of there's the, the buzzing is back. Is it me?
I don't think so.
No, it's mine.
Oh, okay.
There we go. Okay.
More technical difficulties. So just, if you remember, the district put together a one-pager. Do you have it handy, Ethan? It's a one-pager called Social, Emotional, and Behavioral Health Supports, which lays out the increases in staffing and sort of all of the key initiatives that have occurred directed at improving social, emotional, and mental health supports across the district. And so I think with this one, the work product would be that we would hold a specific learning session that goes into greater detail than this one pager. And then we would develop some metrics, again, Dr. Chandragiri, around what we want to see improved, what we think parents and students want to see, like which particular data elements we want to see improve over time and over what time frame.
Okay.
So first, though, we want to learn what all of that work is from the experts in the district doing it before we set the measurable component. Director Hyen.
Thank you. Hopefully you weren't hearing the crow. I kept turning my mic off and there's a crow in my backyard. So I'll comment on each one, if that's okay.
Yeah.
And, okay, so for the 2.1, for the work product, and I'm not sure this is really where it goes, but I want to know how we're involving parents, because mental health and the monitoring and everything cannot happen in a vacuum. We have to involve our parents. So to see how we're going to do that would be good. The climate action plan, as a steward of this earth, certainly I want it to be healthy. But as we look at this, I think we need to take a look at, here's an example. Like California said, in 2030 or 2035, no more gasoline cars will be sold. But yet, then they're having electrical grid issues, and they tell everybody, well, don't charge your electric cars. So, and then as I'm driving to Idaho, I see like 3 tractor trailer links of the giant arms of, the wind turbines to create electricity. And currently these they go in a landfill. They're huge. And they go in a landfill. And that's not a good steward of the earth either. So I would like to take a look at where, if we're going to use some sort of green technology, where did it originate? Like lithium batteries, where does the lithium come from? How is that obtained? And is that really green? So kind of look at the source of things that we think might be good. And then the third one, I can't support the health centers because I'm afraid it's going to put another wedge between children and their parents. And, Madam Chair, I know it's very important to you, but that's just one I can't support. Thank you.
Student Advisor Brennan.
Let's hope that this doesn't cut out. Is it picking it up?
Mm-hmm.
Okay. So I would like to add portions, and I don't really know how to do this, but I'm just going to say it.
Go ahead.
I think we should have an extra part where we discuss like food and ways to better the food that we are giving students, because frankly, it's terrible. And recently, conversations have been coming up again on like how bad school food is, and like the accounts of mold that students have found in school food, and that if we really want to improve the physical health for students, that is a key and crucial part that we need to stop and look at is food for students. Also, the food that we have in our public schools don't cater to students who have allergies. There's a lot of I don't know a better word for it, but like cross-contamination with spilling food into other foods. And so if a student has like a jalapeno allergy and they want to get the nachos, they can't because there have been nachos spilled in the jalapenos spilled in the nacho sauce. And then I also think that for implementing this, it's important that we go out and we talk to students and figure out what they really would like to see, because I know that Isaac and I can give like some perspective, but it's important that we go out and talk to students and ask them what they would like to see improved in regards to this.
Thank you. Go ahead.
Yeah, I had one point back to the first goal, just a really quick thing to mention that I just thought of, and I'll jot down so we can discuss it at a later date, but mainly just, I know there's an option to opt out of some of the state testing, and I don't know if the district uses those things, but to monitor if the data we're getting is skewed at all because of people who opt out. And so just keeping an eye on that so we have the most accurate data. And then also just reiterating what Raylan said about food, because it's not great, and we know how important food is for mental and physical health. Yeah.
Yeah, absolutely. I think they do. In the data, it tells you how many students participated in the testing. So it kind of, yeah. So we can get into all that for sure, what that means. Okay, other directors. Director Chandagiri.
I mean, the food one comes up, and last time we had a presentation, was it from Sodexo? It says some of it is set by federal governments. You have to pick so many things, otherwise you can't bill them, I guess. The funding is, anyway, that's what I learned last time. Whether you like it or not, you have to pick few things to call it checkbox. We are going through an interesting time with all kinds of changes. We'll be having change of superintendent, etc. How do we narrow our focus to one or two or three things that moving forward we just have laser focused, and once the system settles down with a new thing, then we can start taking up. Because some of which are very good goals, don't get me wrong, they are absolutely good goals. They require a lot of oversight and some level of expertise, staffing, transparency, etc. Like getting into health system, for example. So I'm not trying to say we should not. I would say what can be a bite size for the next 1 or 2 years, or maybe next 3 years till the system settles down, and then we can start chipping away. Otherwise, I'm not sure how we will manage all these things. It has become already too wieldy.
Well, as you can see, the responsibility isn't all on the board. That's why it's important that it's aligned with the district, because we're just a volunteer board that can't really make much of this happen. But I would love to hear your suggestions on what you think the top 3 goals should be.
My top 3 goals will be safety, number 1.
What's that mean?
I will tell you. The second thing will be focusing on high quality education so that we'll be able to jumpstart and get all communities back to kind of recharge them, rather than remedial kind of education, jumpstart with the best quality education so they catch up. And the third thing would be an authentic family engagement so that every child, like what we went for the training, Dr. Constantino, you were there. Every family, every teacher, every child, every day, so that there's a two-way connection, because every parent, irrespective of community, want our children to have a better future than what we had. Simple as that. So how do we get our communities to say, I want my child to be a doctor and engineer? What kind of pipeline we start right from kindergarten or even before pre-K? Get on that as quickly as possible. If extra resources you need, that's all part of equity. But safety, what I mean by safety is, when I want our children some of the things are like no bullying, for example, or they should feel safe to sit in the classroom without having to worry about how they look, what dress they wear, what clothing they wear, what name they have, the accent they speak. And there cannot be fights and violence, so that they feel safe to go to the school, walk to the school, and sit in the classroom. I cannot think of high quality education when the child doesn't feel safe, the teacher doesn't feel safe. And they should feel safe that they can speak up and explain what is worrying them. Because when people don't feel safe, whether child or the family, they resort to silence, or I call silence or violence. They'll just withdraw. And you see that kind of, it's not that parents are not worried, but they're feeling unsafe, so they just withdraw, or they get angry and they lash out in their communication or the way they think. Both the cases are not really helping our system get focus back on high quality education. So it has to be, parents have to participate, or families have to be involved so that they can feel safe to share their hopes, dreams, aspirations, fears, etc. And at every level we can involve every child's family. It's possible, because every child's family can be involved either after school program or mentoring or tutoring or peer-to-peer, family-to-family teaching them how to fill out FAFSA or how to negotiate through the system or what kind of classes to sign up. There are a lot of ways in which we can involve families at every level. And we need to, those are the top three I would choose. And then we can start adding some more as we start building the trust and communities start feeling safe to come to our school. We have a high absenteeism, which I suspect could be another reason why they're scared to stay away from our school. So those three things would be a good first start, and later we will have a beautiful system built on that, what I call trauma-informed systems. I don't know if I answered you, Chair.
Well, and if I can, I do believe that definitely addressing the safety is like on option 2, considering how you're talking about folks being able to feel comfortable in who they are and being able to speak up and share how they're feeling. And that's such a large part of that socio-emotional wellness, and being able to really communicate with trusted individuals and have that really established trust in the school district so that they can always have access to the supports that they need. And similar to the folks that may be, as you mentioned, with like bullying and fights and how they might just react in a violent manner, so that way that they have that support where they have an outlet, as we've seen firsthand whenever we went to Four Corners Elementary, and the way that they really take our students and our children who are maybe reacting in that manner because they're being agitated and not being heard and listened to, and helping them process those emotions in an entirely different way. And so it is the hope of us as a board that we could implement that at every single level of the district. And I see that Marty has her hand up.
Go ahead, Director Hyan. We can't hear you.
Oh, sorry.
We can't hear you. I don't know what's going on.
Seems like we lost a little bit of volume.
I think it's our volume.
Yeah. I don't.
Can we turn it up?
One moment.
Can you speak louder?
What? It's not Director Hyan, it's the
Yeah, we turned it down when there
the
was that
screen we have.
Oh, we turned it down.
I don't know. Well, while we wait to get Director Hyan's volume up, I can weigh in. We hadn't really gotten to 2.2 or 2.3 yet, sort of the explanation. And so,
can we have Marty test the mic?
go ahead, Director Hyan.
Can you hear me?
Oh, there, we can hear you.
Yay. So I wanted to talk about 2.4, food. So I know what our families experience at JGEMS, which is at a state-run school at that time for the deaf and now also for the blind, is not exactly what we can do in our much larger district. But there, if you had like an issue with, they would actually have special dairy-free cheese for the little pizzas they make for those students. They also had a garden, and they grew a lot of their own fresh food. And I'm certainly not saying we should have a garden at every school, but I think we could do better maybe by looking at how they do certain things. There are a lot of kids who have celiac or intolerance for wheat and dairy, and there's not usually a lot of options for them. And since we're providing free lunch now for everybody, I would think that a child that had to bring lunch from home because there was nothing suitable on the menu would be something that might make them feel maybe different and uncomfortable. And I wouldn't want that for them.
Thank you.
Thank you, Director Hyan. Okay, so just quickly, 2.2, develop a climate.
5 seconds.
Okay.
Yeah, one thing that I'd just like to talk about with the 2.1 and just empowering our students to be mental and social, emotionally healthy is, can we look to have more opportunities for classes and just general opportunities for students to find like outlets, positive mental health outlets, and I think that would look different in every grade. I think it was Raylan who told me at Judson they had yoga classes, and then just things like recess in elementary school and other activities. And then as you get into high school, that may look more like an actual class that teaches social and emotional skills, but maybe going beyond like wellness curriculum. And I know the district was doing some work with like a third party and with like in the psychology department of the district with like third-party things that have like social emotional learning. So just looking to provide students opportunities and learning opportunities, because I think it's something that students don't have as much because of the pandemic. So just throughout all the different grade levels and all the different school levels, just looking for different ways that we can get student skills and show them activities and outlets that are healthy physically, mentally, and social, emotionally.
Yeah. Great, thank you. So on 2.2, I don't know if anyone else wants to weigh in. You know, I think there's a number of things we can probably do to address climate issues and the decisions we make in the district, and I think they definitely warrant, you know, deep discussion, as Director Hyen mentioned. Director Hinojosa-Presi.
Thank you. Yeah, I'm really glad that Director Hyen brought up the issue with like wind turbines, and also similar to solar panels is that, you know, a lot of people think that they're opting for the best option, but then in your area, be it the state or the region or the country that you're in, you don't actually have the resources and the systems set up for those materials to be recycled. And I think that that's a much larger issue than people actually think. And I would hope that we could maybe partner with some local folks that could maybe create a bit more of an education campaign in our district, because there are so many things that I think people don't ever consider, that you think that you're opting for the best alternative. For example, like washing your car at home. You're like, oh, I'm going to save money and try to save some water, but your house and the sewer system that's in your locality is not set up to catch like everything that comes off your car. But if you're taking it to a car wash, it is specifically set up for that. And I mean, I know this because of my work through transit. And I know too that this could be a great place for us to partner with the city of Salem, because they do have their climate action plan and they want to reach certain metrics. And I know that a big contender of actually being able to reach some of the goals that they've set is with transportation, and the fact that we have our buses and are providing transportation for our students. How can we create our own fleet that would help benefit that in zero or low emissions? Yeah, so that's what I had on that.
And one comment too, one really big climate action planning is around where do you infuse curriculum? And so that's right there.
Yeah, so as we've laid, just one second, as we've laid out, the proposal would be the responsibility would be the district via a district/community work group. So that would be established to then talk through all these issues in detail and come up with plans and strategies for the district that the board would then say, you know, have buy-in into to achieve over time. They would report quarterly back to the board in the boardroom, so that we would be sharing those efforts over time. So that's sort of the strategy laid out with what the work product and whose responsibility it would be. Dr. Chandagiri.
Yes, sometimes when I think of climate change and climate action, we think of big things, but it can be starting from kindergarten onwards, like incorporate it as part of your daily learning. So it could be as simple, but it will have long-term profound effect. So we don't have to break our budget with something very big to start with. It could be as simple as K-12 curriculum, does it cover this topic? It could be like, can the next generation science standard start talking about, is this part of a curriculum? Can you give an elective on this? So there are different ways in which we can make it as part of our thinking psyche, right from the time they're little kids to graduation, which will not cost us enormous amount of money, but it could be part of your science curriculum or language curriculum or culturally responsive ways of protecting our nature. And so it could be modest, but the effect will be long term. So let's think small things which are affordable, and which is doable right away, rather than waiting for a committee to make some suggestion. That's my 2 cents.
Okay, thank you. Student Advisor McDonald.
Yeah, just kind of going to what Director Shandagiri said. I know at West Salem High School, a couple years back, we looked to really add some courses regarding climate change and education in that realm, and we had a lot of enthusiasm from teachers about who wanted to teach that and wanted to educate students, and we had a lot of success in bringing in like an AP environmental science course and some other like oceanography courses, and I think we're looking to get a garden course. So I would just want to say that I think there are a lot of educators out there who really do want to empower students with this knowledge, and so I think it would be really doable at the school level, even middle school, elementary school, just to really get the information out there. And then there also are courses available for our teachers to adopt that really do a thorough examination of like climate change, environmental science. So I think that is a really good idea.
Great, thank you. Student Advisor Brennan.
So first I kind of want to like jump back and then I'll jump back to this. But talking about 2.1, the monitor the social, emotional, and mental health. Yes, Isaac, it was me who told you that we had yoga at Jetson. But I think it's, well, if we did implement this, that what's really crucial to have is providing students with opportunities to have conversations with teachers that not only that students trust, but that are also open to having nonchalant conversations. And so that way it gives students outlets to actually talk and express how they're feeling and what they're feeling, and then also like issues that are like important to them, be it that be maybe like a communications class or something in which students can just open up and have conversations. And then going back to the 2.2, I agree with what Isaac said about like, you know, I think most high schools have an environmental club right now. And I know at Sprague, I think we still have it, but last year we had field bio, in which we learned a lot about climate change and different ways to help combat it a little bit. And so I think I remember one way that we talked about of problem solving and helping to decrease like emissions and whatnot, and also like how much with like also trying to help absorb how much carbon we're putting out into the air. And I remember one of the things was rooftop gardens. And I know in DC, if any of you guys have been to DC, there are gas stations that have rooftop gardens on them. And so, and this is also me being a little biased, but I think it would be really cool if we had rooftop gardens. And then we could also do a little bit of the thing that Director Hyen was talking about previously with having gardens of growing food in. So, yeah.
Love it. Great. Okay, so I know we need to move along, but I love the conversation. I just want to quickly talk about the action plan for a school-based health center. Up on the screen right now, we have the map of which school districts and schools, I believe, have school-based health centers. I'm not sure, I haven't seen this board talk about school-based health centers before. May have happened a long time ago, but they're really important for opening up access to students who don't have as much access as some of us do to primary health care. And so school-based health centers, are medical clinics that offer children and youth health care either in a school or on school grounds. They help children and youth get the care they need when they need it. They have primary health care providers such as doctors, nurse practitioners, or physician's assistants, and some have dental and mental health providers as well. They work with the school nurses to help the youth stay healthy and safe in school. And then you have a community partnership in general that includes with the school boards, parents, students, medical professionals, and that whole support network supports the school-based health center. Some are also co-located with a federally qualified health center, or that is their partner entity. And so what we're proposing is that there's a district led work group to come up with an action plan for implementing. The action plan could recommend how many school-based health centers we would need to really meet the need in our school district. It's a pretty widely utilized sort of model nationally, obviously in our state here, with us being, tied usually or back and forth with Beaverton for second largest school district. I think it's a gap in our community that we should be filling on behalf of kiddos who need access to health care. So you can see Marion and Polk counties each have a school-based health center. So one located in the Central School District in Central High School and the other at Chemawa Indian School. But there are no school-based health centers across the Salem-Keizer School District currently. So the work group would put together a plan for how we might be able to achieve implementation of a school-based health center and report back to us quarterly. Director Hyen?
I can't hear.
Oh, no, we can't hear you again.
You turn me down?
Yeah, there we go. Okay, go ahead.
I'm for access. My concern is that since the legislature passed a bill several years ago that 14-year-olds can get health care without parent involvement at all, and parents aren't even notified, that we could, by having it there in the schools, parents aren't going to know necessarily what's going on with their children, and parents are responsible for these children, and they could make choices. They could have long-term, lifelong effects, and I'm just concerned that having it right there in that school is going to lead to more of this and keeping parents out of something that they're supposed to be a part of. That is my only concern about the health centers. I understand the access, especially for kids that don't have access to health care. So it's about parental involvement.
Thank you. Director Chandragiri?
The two questions is, how are we going to pay for this parallel health system? Are we going to take it out of our school budget? Second question is, why can't we contract with other primary care clinics or pediatric clinics and have something like health voucher where the child can go and see, rather than trying to create another entire health system independent of a thing? Because we have some primary care groups, pediatric groups, pretty much all the children, most of them will be covered by the CCO, so they can be billed through the CCO. So why are we not having vouchers which will allow us to send some who may not have health coverage? And now Oregon is coming out with a new form of Medicaid, similar one, I forget the name, for those who may not have the right immigration status. Even they can be eligible for health coverage at a Medicaid level. So why can't that be an option that we can have memorandums of understanding with local pediatric clinics and hospital system, rather than trying to duplicate a system and create a new system, and it has lots of oversight functions. And then where the money is going to come from, I'm not sure if you're going to try to create a new system.
It's not, well, my understanding is it's not creating a new medical system. All the types of insurance from Medicaid, all through private pay, et cetera, would be accepted at a school-based health center. And in general, yes, it's a partnership. I'm not an expert, but a partnership with an existing local provider. And the access part comes with it being on campus. Like, I mean, I'm sure you've seen how successful like mobile dental clinics are in providing kids with on-site dental care, because the access piece can be hard for some families just to get their child to the healthcare provider. So it's really opening access by having it right there at the school. Go ahead.
I'll go ahead and let Raylan, because they have their hand up.
Student Advisor Brennan.
I think that it's important to have these in schools. Well, because number one, going, depending on like where students' parents work at, and if for transportation wise, and what kind of medical care a student may need, it can be really hard to get that medical care because depending on sometimes it's specialties and whatnot, and I don't obviously know like everything that would go on within it, but I know in the past I've had to go to doctors in which I missed school, and my dad took me up because my dad works in Silverton. And so we drove up to Silverton, and then he would have to leave work early, which not all parents are able to do, and then drive me to the Portland Hospital, in which it's important to remember that not all families have access to easily accessible transportation, but then also can't always take that time off of work for students to go to the hospital and go see like a doctor and whatnot. And then even sometimes with insurance, not all insurances cover stuff. And so not all families can afford to pay out of pocket. And so, which is really unfortunate, which is why I would like to see this happen in schools.
Thank you.
Thank
Second
you,
Vice Chair.
Yes, back in, what was this, 2017, 18, when I was in grad school for my Master's of Social Work, a portion of the facilitation and work that I was doing was discussing with students their options and in terms of visiting school-based health centers. Until that point, I did not know it was a thing because I was a student in the Salem-Keizer public schools, and to me, it was an amazing opportunity, right? Just to know that students were able to step out of class for, a 20-minute appointment and be able to come back without having to be picked up. It also reduced that, just like Student Advisor Brennan said, that toll on families to have to, pick up students and drive them. And also the other piece, I think, this is to develop an action plan. And with that, we'd also be looking at, once then we get to where the health centers would be located. Also, there would most likely, thinking about, there's going to be limitations in terms of what kind of services. And so I think that'll be another conversation to have. A school-based health center would most likely not be able to support a student with like chronic diseases, for example. And so this would be a place where they would be able to get a checkup, if for something a little bit more minor. And to Director Hyen's point, I absolutely hear there the concern in terms of, like the parent involvement and wanting parents to be aware of students' medical needs or the attention that they're seeking. And I think that also, in terms of what we're doing as a district to supporting those healthy relationships between students and families considers this as well. If state law does allow for students 14 and over to seek certain medical care, and families are aware. And so I think just one of the pieces is that we continue to encourage and inform families of the services available, and that we continue to encourage families and students to have those discussions, those conversations, so that it's in a collaborative decision-making process as well. But to me, this is super exciting to be able to think about expanding access to students and to families. And when we think about the long-term health of our community, this is so important. This is so crucially important. I also just want to make a quick point on 2.1. I am very appreciative of taking the distinction between social, emotional, and mental health supports, and just considering when we come to that conversation, I would love for us to think about that, that conversation is, as it's stated here, is district responsibility, but as we think about the responsibility moving forward and identifying, key strategies in that is that we consider a community approach as well. To what we heard from some of the students, there is those specific supports in schools, like different clubs, different maybe relationships that folks have with educators, but also how are we connecting and building relationships with our communities to make sure that across the district we have safe places, welcoming places, culturally specific places for students and families to be able to gather to build community and therefore have that social emotional wellness as well that we know in the long term leads to and supports the mental as well as the physical. So this goal too, I would say I'm super excited about all across.
Thank you. And I think, Director Chandagiri, I don't think we answered your question about funding. I know we talked about some of the payment mechanisms for the actual care. I know I saw several years back there was some state funding made available, like grant funding to help with the planning and establishment. I don't know if that's dried up or if there's more funding opportunities like that, but I know that I don't believe in general it's like a deep cut into the base budget of the district. It's really entities coming together to improve health outcomes, and so everyone's willing to kind of come to the table and provide resources.
Well, and that work group would be one of the things that they would they would tackle would be like if we're using through the district or like local providers, individuals, grants, and other fundraising. And then two, one of the statistics is that when students receive care at school for their healthcare needs, the daily attendance increases, which we know that like we've got a lot of things about how often our students are in school and tied to funding. So there's just like various different revenue sources.
So Chair, thank you very much. I don't know the answer, but if we decide to start something like that, we need to be able to sustain it. That's really important. We can't just leave our kids halfway through and say the funds dried up or doctor didn't show up or we lost the contract. And the second thing is we need super transparency and high standard to maintain, because that way parents need to know, because if somebody starts a medication, at the end of the day, the parents are to take care of the family, needs to know if there is a complication to the child or medical complication. Because at night time, we won't be there to take care of the child. And, how are we going to make sure that we are able to have a quality control over this? I'm not entirely clear because the rest of the healthcare system struggles with the Medicaid funding and access to care, etc., manpower, etc. So, it's a good aspirational goal. Don't get me wrong. How are we going to pull it off and sustain it? And are there ways, rather than creating our own parallel system, can we have simple contracts with people to come and help us here, like we have had for mental health? The county, I believe, Trillium and some county comes and helps us. There are some simpler ways without breaking our budget. And I'm looking for sustainable plan, which is good quality and transparent so that everybody understands what is offered and what is not offered. They shouldn't have high expectation and then we can't meet it.
Yeah, I would expect nothing less in the action plan that they bring forward. We would not want an unsustainable action plan presented. Director Hyen?
Thank you. Can you hear me?
No.
Oh, one moment.
One moment.
Director Hyen,
Now try.
Can you hear me now?
A little
No.
bit. Try again.
Keep checking.
Maybe if you just go check 1, 2, 3.
Check, 1, 2,
Oh,
3.
there we go.
All right, so two things. One, there's no such thing as a free lunch. So, and I know these are questions we can't answer right now, but does the service that certain students get depend on their parents' insurance? And if something's not covered under your parents' insurance, I can't imagine it would be covered there unless there's some other form of money. But again, there's no free lunch. Somebody's paying for that. Like the taxpayers. And then also, a big concern of mine is if certainly a student probably has a primary care doctor and they go into the health clinic and say, I have this issue. And if the student does not tell the practitioner maybe all the medications they're on or health conditions, because, you know, for some people that's hard to keep track of. I mean, it's hard for me to keep track of things. So we could have a student that's given a prescription, I'm assuming, that could negatively interact with something their primary has been given them, and here no parent knows about it, their primary care doctor doesn't know about it, and we have a very bad outcome. And just because they can just walk in and get some services, you know, if we're checking for a fever and different things, you know, that's one thing, but, you know, we could be giving prescriptions and different things like that. I'm just really concerned about the well-being of our kids.
To that point, real quick, Dr. Hyen, and again, no medical expert here, but there are like shared medical record systems. For example, there's Epic that is very like commonly used in a lot of the clinics and hospital settings, and so providers can see a patient's record and see the medications that they're on. Because I mean, I absolutely understand the concern there, but I'm just the amazing access that we have now through data, and I would imagine that if we took these steps for a health center, that we would want to make sure that we had access and that we were using systems to be able to access students' medical records to make proper decisions. But then again, there's restrictions, and there would probably be limitations on, what schools and then what decisions minors would be able, like medical decisions. There are limitations there regardless.
Mm-hmm.
There's HIPAA plus my doctor, we use my chart. I don't know anything about Epic and if they would also use that, but like Salem Clinic and Salem Health, Salem Hospital use my chart. I'm assuming that's different than Epic, another kind of system. And I have to give permission for another doctor to see that information. They can't just get it themselves.
Okay, Student Advisor Brennan.
Well, I don't know if it's different being a minor and being an adult, but just going to the My Chart aspect, there was one day in which I had to go seek medical care because from someone other than my primary doctor, because my primary doctor was out of the state at the moment. And I don't remember the place I went to, but it was downtown, and I didn't give them, like, I never, like, specified or signed anything saying that, like, they could, like actually verbally, like, saying, yeah, you can look at my chart. However, by seeking medical care from them, they were able to look at my previous medical records, and I don't know if it's different because I'm a minor, but that's my personal experience. I also want to point out, in my personal opinion, that I think that students like myself who are have the opportunity to have a primary care doctor, because not all students have primary care doctors, unless it were absolutely necessary. Like me personally, I would most likely go to use my primary care doctor. But I think that having a school-based health center would be very beneficial for those students who unfortunately don't have the option or don't have a primary healthcare provider.
Well, I'm really appreciating all this conversation. So I'm really hoping that we can maintain this momentum and all of these pieces. And there's just been so much great input and ideas that hopefully we can then pass on to our work group to really hash out like all of these finer points on like, how exactly are we going to sustain it? How exactly are we going to make sure that we're going to receive funding, the access to the records, and also in terms of like the communication out with outside entities, inside entities, and the scope of services that would be able to be offered within the student-based health center. So I'm really looking forward to our future meetings in discussing that. So I really appreciate everyone for that. And I just, for the sake of time, I think we need to move to goal 3.
Director Avila has not had a chance to speak to this one.
Well, Vice Chair Nose Pressy pretty much summed up what I was wanted to share, and just to just reiterate the fact that, you know, everyone's bringing up really good points, but there's a lot of questions in this bring a school-based health center. You know, remember what it's for, to create quick and easy access for our students and not have them travel. So that would, you know, contradict what Director Chandagiri is saying. You know, create access for our students who don't also have to go to transportation, seek out transportation and travel, as Director Hine was saying. Yes, of course, we are aware of HIPAA rules, limitations, information, but it can also be educational. And so I think a lot of information has been provided. I would support getting this district and community work group going. And as Vice Chair Nose Pressy is saying, let's get these questions answered before we're making decisions when we do have questions. Hopefully those answers will be provided.
Yeah. The best news of all is that we're not the first ones doing this. So all these answers are out there in like high functioning school-based health centers across the state and the country. And so we could also tour some, we could tour the Chema one maybe if they would be so kind to allow us to do that, or go to the central one in Polk County.
CHS 97.
And there you go. And kind of, we could ask some of those questions. We could bring experts into that work group. So, I think it's a pretty, widely utilized model for a reason. And I think hopefully if we got some of that info into the boardroom, it could allay some of the fears. And, but I also second our first vice chair that I'm just really thrilled that we're having these conversations and that everybody is invested in establishing our goals. It's been requested that we take a break before we move on to goal 3. And so let's take a 10-minute break this time. We will come back at 7:46. Does that work? 7:46. Thank you. Okay, welcome back. All right, I am going to turn it over to first Vice Chair Inohas Pressy to lead us through goal number 3.
Okay, thank you, Chair Carson Cottingham. So goal number 3 is equitably improve the conditions and systems that lead to safe and welcoming schools for students and staff. And broken down, we have 3.1, 3.2, and 3.3. So 3.1, create a safe and welcoming schools work group. The responsibility is on the district through a district community work group. Our metric and work product will be monthly meetings and reporting on those school safety metrics. And we want monthly written updates to the board. So I'll open it up specifically on the process and the work product for folks. Director Hyan?
Can you hear me?
Yes.
Awesome. I just want to make sure that as we set up the groups that we have representatives from all groups, not just minority groups, but all groups.
Thank you. No, okay, awesome. Oh,
I have a question. So how is this going to be different from what we have already had? Like monthly, there will be a report attached to the thing. In what way we are going to see if the trend keeps getting worse or the numbers keep getting worse? What are we talking about? I'm not entirely clear because this was a topic that we brought it up last year.
Mm-hmm.
And the numbers kept getting worse, and kids were not safe, and we've seen some of the very difficult experiences in the school board meeting where parents and some youth. So I really want us to little bit more drill down and say what exactly are we referring to in this? Because to me it sounds like, yeah, we want it. What exactly are we referring to? What that goal would look like?
Mm-hmm.
And I don't think there is. I mean, we have been talking about reimagine safety for almost 2.5 years now, Superintendent Perry. So when are we going to drill down and be a little bit more concrete and what we want to see? I think there is a disconnect between what we are discussing here and what we have been experiencing. A school, when people don't feel safe, they become quiet or silent or withdraw. I'm not entirely clear by this goal what exactly we are going to be achieving.
Well, and I really appreciate the enthusiasm. That's why I'm right here. What we're asking for is to establish specifically the work group that, again, would implement those goals specifically. So when you're asking, what are we asking to be done once we're establishing and putting together that work group, like, how Director Hyan mentioned, she would like to see a specific approach into including community in the work group. So we're definitely going to take that information about, so what are the specific goals that we want that work group to work on and establish, and have those metrics and reporting so that way we can do that drilling down that you're asking us to do.
Didn't we already have a work group about 2.5 years ago or 1.5 years ago that for reimagine safety and discipline? So we have already done this work. And you're talking about coming up, so the goal is going to be to establish a work group. Is that the goal, or the goal is to have safety in the
Yes,
community?
so our 3.1 says create a safe and welcoming schools work group specifically.
But that was already achieved, I thought, about 2.5 years ago. So what's going to be this different from that?
Director Chandragiri, you've been coming to the board meeting since I joined the board to talk about how important it is that we drill down on these safety metrics, all the data that comes into the board packet, that we never have enough time to get into the weeds on what all of those things mean to our students. And so this was specifically a strategy created to address your idea of having time with you on this group to drill into the data and then bring it back into the board meeting.
Well, that is a different thing, but what would be the goal be that, because we already have a definition the district has come up with, reimagine safety and...
That could be part of it, but this particular strategy is to create the work group to look at all the data that you started the work, right? You did the hard work of pulling together all those different components and bringing them into the boardroom before we were even on the board, right? Because you believed those were things that were leading indicators of safety and well-being for kids, was my understanding, right?
Your understanding is correct.
Okay.
And Dr. Sproles was the one who suggested these are the elements they are already collecting. So without adding additional expense to the district. So correct. So if I understand from what you're explaining, so we will establish a committee which will start looking into those data and trying to use data-driven, some kind of plan to
Correct.
monitor and ensure that we'll remain safety. Okay.
Yeah, and to make recommendations regularly from that group to the board, to be highlighted in the boardroom, to make recommendations to the superintendent. Because we've noticed that over this past year and a half, just having all that data in the boardroom doesn't mean we can spend 2 hours drilling down and knowing, like if one measure is changing or one thing shot up, we don't know exactly how to address that in a formal board meeting. But we do know that we can put together expertise like you and others to look at it and come back every month or quarterly to say, here's what we're seeing, here's what we think we could do to make an impact as a board.
And there will be some way to have some accountability so that we can demonstrate to the community we indeed are making the changes, or is it just going to be looking at the data? I'm not entirely clear in this discussion.
Well,
The
our
committee-
accountability is that update to the board
Okay.
monthly.
Just quick clarification, First Vice Chair and House Presi, when we're including district in various one of these responsibilities, and are we making sure that we have kind of district personnel, like for example, in this one, would it be counselors, educators, TAs that would be part of this, or would it be more of high-level managers, administration level?
I believe right now Assistant Superintendent Udos Nata is going to be leading on this effort and then putting the group together. And that Director Chandra Gary would be our board liaison
Okay.
as envisioned. But others to be added so that you have all the right folks to be looking at that data.
Yeah. Great, thank you.
Thank you.
That's correct, right?
Yeah, that is correct.
Okay.
And we really wanted to start around the research and framework for safe schools. So we really ground the committee's work in, here is what the research says about safe schools. Because I think in just a data report, we lose sight of what are the effective practices you should have in place around safe schools. And then what should be your data metrics to monitor. Maybe we'll find in that group that we need to change a metric or something as well, but it was trying to ground ourselves in what the research says about.
And building on all that work. So we're not losing anything that was done prior to, us being on the board. It's all kind of a continuum and making sure we're utilizing all of that with today's kids and what we can do to make a difference.
Student Advisor McDonald.
Yeah, I was just wondering if we get that work group also to maybe collaborate alongside the student district advisory group, so we get some student input with them too.
That's a great idea.
Ethan, did you take that note? Okay. Anything else further on 3.1? Okay. So with 3.2, we have discuss SROs, and the responsibility is on us as a board. Our work product and metric is having a board work session, and we are hoping to have this reporting or completed in October of 2022. And I see Director Hines' hand shot up.
I can't hear.
Still muted.
Needs to
I think
unmute.
when Ethan is sharing, it goes down.
There we go.
No.
Yes.
Yeah, the reason that I requested this, or it could have been somebody else. Too many people were in the original discussion. principals are having to pick up the slack of certain duties that the SROs are doing, I believe reporting and things like that. Even the student group that met at the end of the summer or early fall wanted to keep them in some form, maybe with some changes. So what I'm not recommending though is what I experienced in the ER yesterday, where if you go into the ER, you walk through a metal detector. And if you have any metal, like even a box of Altoids, you get pulled aside and checked. And even if you arrive by ambulance, there are 2 officers that come and wand you. So that's not what I'm wanting in our schools. But what's going on in our community, the hospital has heightened their security so high. Anyway, as I said, many educators, teachers, vice principals, maybe even principals, parents want them back. And we need to have a real discussion with our community and not leave anybody out. It's not always the loudest voices that speak for the whole community.
Thank you for that, Director Hyen, and also sharing with the community of what's going on in the community in terms of the over-policing. So I think I just wanted to make a note that this is definitely important work, but I'm noticing that we're definitely kind of biting off a little more than we can chew here in the October work session. So we might have to adjust our timeline slightly. As in our October work session, we're also wanting to analyze goal 1.1 with the KPIs.
And if I can just ask what kind of clarification on this discussion would be like what's the setup? What would the goal be? Because we've also been hearing from many community members, educators.
The echo just adds gravitas.
That they don't want SROs back.
Director Hyen?
I don't think for me this is really a work session item. I think it's an item to take to community, and this time to make sure.
I can't understand.
Okay, one moment,
Hold
Director
on.
Hyen. Oh, we're so sorry.
Technology.
He's coming.
Somebody's really getting their steps in today.
Lots of steps.
Go ahead. Director Hyen.
Try now, Director Hyen.
It was my fault for not doing check 1, 2, 3.
I think the echo's coming through now.
Can you hear me now?
It's slightly, you're pretty soft.
Okay, I'll speak loud. Can you hear me now?
Yes.
Yes.
Yeah.
Okay, so I don't know that this is really a work session thing. For me, from the people I'm hearing from, I think we need to go back to the community and this time make sure that we're really hearing from everybody. I don't believe we were hearing from everybody. Otherwise, there wouldn't be so much of these things that I'm hearing. So I really want our district to go back to the community and parents and students especially, and our employees. Some of our employees are not feeling as safe as they would like to feel since they're gone. And I know you're not going to make everybody happy, but again, I don't think we really listen to the entire community, and that's what I would like to see happen. So it's not really a work session thing. It's we go back to the community and see what the community wants.
Thank you, Director Hyen. I really like that idea. Before I go on to that, Student Advisor McDonald.
I think there was also already a community meeting regarding SROs, right? And if there was there or wasn't? I had a question, like, what was that like?
I mean, if I think
Was there?
Did I answer that question?
There were multiple, there was a student work group, we did some community listening, we went through some community groups, and it all happened kind of during that pandemic time. And then came to the place where we just felt like it was the right move at that time. So.
And one of the groups was a student-led group where adults were not allowed in, and their report said they wanted SROs to remain in our schools.
Yeah.
So I'm thinking that we can kind of reassess the way that we're coming about this strategy. And I really appreciate Director Hines' comment, because I think this could be something that we could either integrate into our goal 5.1, which we're going to be getting to here in a few, about having listening sessions in high school feeder areas, but also a task to include in our work group that we had just mentioned right ahead of this one. So I think this one might need a little bit more workshopping. And I also appreciate Isaac bringing up the work that has been established before, because again, similar to the synergy that we're wanting to maintain with our Safe and Welcoming Schools work group, it's maybe we can bring that data and information back also and analyze that just to see where we're at and maybe make it twofold. The work group can reassess that data, and also we can make sure that we're having that in our listening sessions with the community. So that way we're not losing the work that's been done, but we're also making sure that we're including the community. So workshopping that a little bit.
Could I ask that the report given to us by the student group be sent out to the boards and our student advisors?
Is that something that we
For a
can do?
refresher?
Okay. Just wanted to note that Christy said yes. Okay. Anything further on 3.2? Director Shandagiri.
In 3.2, one of the suggestions that we made was to do, the district has a way to electronically connect with all the families and all the students.
Mm-hmm.
And one of the suggestions we made, I don't know if it was followed up, maybe it was, I don't know, is to do a little survey so that people can anonymously fill out the survey. And that would probably be your last item of authentic family and connection, or one way or other. Because this has not been a safe topic for people to voice in a public meeting, to be honest. And there is no way we can create that level of safety in the middle of pandemic and social unrest, etc. We all tried our best, we couldn't. So there are some who felt scared of the police. There are some who felt so scared that they needed the police. So it was like, you're right, as Director Avila said, there were both camps ending up. So it was not for lack of trying. I'm just giving the historical context. We really labored through this. One of the areas perhaps we missed was to do a survey where people could anonymously fill out all the 40,000 or 50,000 people we have in our district with students. Perhaps that anonymity would have helped people to be honest, safe, because one of the things we found was very difficult to get a proper input from everybody. And there are several families who had one opinion, but they were too scared to come to the public meeting and give a public comment. Some asked their first names to be only used, not to use the last name, from both camps. Mm-hmm. So I'm not sure the sampling was such that we heard from the two extreme groups who were either one end of the spectrum or the other end of the spectrum. But that we didn't have much data point for us to base it on. Mm-hmm. Our civil rights data collection had a totally different data to support it. Then we also had a very thorough, deep diving discussion with three people. Christy did a good job. Superintendent, you did a good job of holding such hundreds of hours a meeting with three at a time. So the data didn't connect with those 13 officers being let go. We realized that the challenges were in the front end at the discipline level, which was there. As you rightly said, the mission creep is the word you used, or how it all got mixed up. So it would be a good time. I would ask you to have a separate work session. We can flush out all that. And I really archived a lot of that background information. I'll be happy to send the entire dossier to all of you, and you can review it, and then let's do a proper, thorough due diligence to it. I don't think we could do a due diligence when the decision to remove SRO was made, in my opinion. In fact, it was more like a pressure relief under extraordinary circumstances. It was very unprecedented time in our district's history. We had to do something. Everybody was suffering. Perhaps if things were different, things were a little bit more calm, the national tragedy got kind of imputed into our community. So people got scared. People really got scared. Unfortunately, we couldn't think through what are the downstream effects of taking that kind of abrupt decision. Ideal would have been a community policing model where community and the law enforcement and the district, everybody sit together and work out how should we work on this safety. I don't think we could accomplish that. Redesigning our discipline policy, we couldn't accomplish that. Reimagining safety also we couldn't accomplish in the timely manner because we were dealing with so many other issues. So my thought would be rather than just pushing it through a half work session, let's do some due diligence because ultimately it's the superintendent's operational decision. It is not the board's decision. So we really have to see what will be, but legally we are responsible for safety and we have delegated it by an executive limitation to the district. Now, if the SRO is not there, what are the alternative models that safety can be implemented is what we could perhaps be focusing. Or do you want to have a hybrid model? What will it do to our risk assessment? There are so many things we couldn't think through in that time. That is my honest feedback to this discussion. And we really need time to think through rather than rush through this thing. This has unimaginable implication on our children and families and community, as you can hear in this brief discussion. Thank you.
And thank you, Director Chandagiri. That's exactly why we felt that you were a great fit for that Welcoming Schools work group, as I think that survey is something that you could definitely tackle in the work group and really look forward to also receiving all that data and information that you have. And also like the updates and information that you'll be providing monthly through that work group. I see Karina had her hand up, and then we'll go over to Director Hyen. Anybody else on this side after that? No? Okay.
I think for this one, I recognize it's on here, and we're, respecting the request that Director Hyen has brought forth, and that other board members have as well, to have this be an item that we discuss in the year. I think extracting it and having it, be as a standalone or saying like, let's do engagement on just this particular thing. To me, it seems short-sighted in the sense that we have to think about the system as a whole, right? Like what our families and students saying to us is enforcing that sense of safety, that sense of belonging, and then like what are the areas of need, and for us to extract that based on these very politicized ideas or whatnot, it feels like a drain on the time that if we're going to move this forward for the district, for example, to do. It would not be my first choice. I just really wanted to voice that because I feel like it's encapsulated in the strategy 3.1. Really looking in that work group at what are welcoming and safe schools, really for us to understand what are restorative practices. There's gaps, I believe, in our board and in our community to understand, and this is new work that's happening. There's been growth, there's been improvement, and also just to think about when the decision on SROs was made, we were in the midst of a pandemic, we were still in a pandemic, and we just have to recognize that students have been impacted social, emotionally, even their physical well-being because of the pandemic, because of lots of different barriers and issues that have come up over the last few years, and that we need to look at it as an entirety, like as a whole. So I guess I'm really just kind of frustrated that we are thinking about taking additional time on a decision that has been made, that we do not have decision-making power as a board, and when we can be looking at the system as a whole and focusing on that as our goal. But I digress.
Well, so, I definitely think that I heard from Director Hyen that the work session is not the right place, and reiterated here with you as well. Second Vice Chair Guzman Ortiz, So I think we'll definitely workshop this one to reintegrate it into some of our other strategies instead of having it as a standalone. Director Hyen, we have our tech person on standby to make sure that we can hear you.
1, 2, 3.
There you go.
All right. So, just a couple points to make before we probably move on to the next one. The entire board wanted to keep SROs. Now, the district is the one that went into the contract with the SROs to begin
Different
with,
board.
so it wasn't our place. But that doesn't mean it couldn't be our place. So decided. Also, I want to point out that a lot of the situations that I remember reading, encounters with officers, the SROs were blamed for certain things. These were actually not the SROs. These were, I'm going to call them beat cops because I don't know what the correct term is, but you know, the people walking the beat or out in the public. They were not SROs. The SROs are there to establish relationships and help kids. That is their primary goal. And the other unfortunate thing, I talked to somebody who filled in as an SRO for a while, and he was pretty disgusted. Administrators were taking, or at least one, I don't know about all.
Director Hyen, I think what we just need to decide right now, like we don't need to get into the weeds of the topic right now.
We just have one sentence. Can I finish it?
Fine.
Okay. The administrators were using SROs to do the job the administrators should do. And so that led to a bad reputation for SROs.
Okay.
That's it.
I don't know that that's true, but.
So again, I think that we have like a very healthy discussion about the future of this point. And I just want to pull us back that right now what we're talking about is the goals and the strategies to achieve those.
I'm hearing conflict though. First Vice Chair, like I thought I heard Director Chandragiri say he does want a work session on this. Director Hyen is saying we don't have to decide that right this second, but could we get clarity because the 3 board members requested and that's why we specifically were going to do an agenda item on this?
Yes, Chair. Thank you. 3 board members requested it as an agenda item.
Right.
Not a work session. But if you really want to understand this complex issue.
I'm not asking for it to be on the agenda.
Let me finish, please, Chair. I really think it requires our community and the new board and all of us need to revisit. Because right now the kids are back. This was initially sold to us as though the school is in closed pandemic. And that time, so this is
Director Chandragiri, you don't have to justify it. If the 3 of you want to have it as an agenda item, we will have it as an agenda item. That's our commitment. If we want to have a robust discussion on it, it needs to be at a work session.
I agree with you, Chair.
Okay, so my only ask as the chair is will you work with your colleagues and determine next steps on this topic?
I support a detailed work session, a standalone work session on this topic. That's my personal thing. If we want to understand the issue and make a decision. But if we just want to make a decision without understanding,
we understand.
You're the leadership. Please, this is a very serious matter we are discussing.
No one is minimizing the seriousness. This is simply a logistical question on whether we want to have it on a future school board agenda in our board meeting or not. And we don't have, I'm not putting anyone on the spot either. Like, we can talk later in not a quorum, right? And just determine, because it feels like we have disagreement amongst 3 that requested it. And so I don't want to put anyone on the spot. I just want to get clarity.
My position
so that we're following the rules.
My position is we should have a work session and then followed by an agenda item. That's what I would put. That way we all are clear why we are doing what we are doing. And it gives us chance to spit and discuss. Otherwise, we get only 2 minutes to discuss in your agenda item, right?
That's not true.
Well, not in the work session.
And it's not true in our regular meetings either. You get more than 2 minutes to discuss.
You're right.
Okay.
Madam Chair, why don't we get back to you on that? We did make a request for an agenda item, I believe, back in May.
Right.
I will talk to my colleagues who also want this discussed, and we'll get you an answer, okay?
Thanks. Yeah, I just want to make sure we're doing what the requesters wish to have happen in the boardroom.
I understand, and I appreciate that. I wasn't looking for a work session, and I understand different people have different expectations. So we will figure it out and get back to you.
Awesome. Thank you.
Student Advisor Brennan.
So before I say what I have to say, I had a question. So does that mean that we're not going to discuss 3.2 anymore, or on whether or not what we should do, like whether or not we should postpone it, or?
Yeah, so the discussion is 3.2. How do you feel about the work product and metric and our completion timeline?
Okay.
Could I request we leave 3.2 there as a kind of like a bookmark, a tickler about the issue until we make a decision?
Mm-hmm.
Can I still say something on it though?
Yeah.
I want to kind of step back to what Shonda Gregory was saying earlier on having a survey sent out to students, and I definitely think that we should not do that, or at least not have it as our primary outreach to students, because I can tell you that the majority of students in Salem-Keizer schools do not take surveys seriously. And that will not give us the information that we're looking for. And rather, I would say that before we have, whether it be a work session or a business session about it, that we go to schools and actually have conversations with students to gauge how the majority and as many students as we can talk to and gauge how they feel about it before we come to a full conclusion or even talk about it.
Thank you. So I think, again, just to reiterate, we will be workshopping this because I am definitely hearing about we need to have listening sessions with the community, and then also hearing about how we do need to have it as an agenda item. So just, it's here, and our work, actual product and the metric and our timeline will be adjusted. And now 3.3, deepen understanding of restorative practices, including what it looks like in elementary, middle, and high school environments. So we're going to be having learning sessions and then have updates on the progress of that. And our timeline is early 2023.
Just a clarification on learning sessions, does that just mean the like a committee would come and share what's going on, and have those been taking place, and are Raylan and I included in those?
Yeah.
Okay.
Yes, yeah, we would have presentations and specifically to learn about it. And yeah, I mean, as the whole board, we'd be participating in that, and that includes both of you. Director Shandagiri?
Yeah. As far as the 3.3, one of my wishes to see that this really leads to change in our policy. There is a policy how we will apply and implement, monitor restorative practices. Because the policy hasn't, if you use the same old policy, and even if you learn about restorative practices, you're going to get the same outcome based on the old policy. So really this has to translate into tangible policy change. An example of restorative practice.
So would you like to add that as a work product / metric? Is using that to update a policy?
Absolutely.
Okay, thank you.
That should be a measurable policy change so that families understand what restorative practice will entail, and then they can hold me or us and the district accountable. Students know what to expect before they go in, and so that all parties are understanding that both will have to agree to participate in restorative practice.
Okay. So that's another one that we'll workshop in updating the policy as well with 3.3.
First Vice Chair?
Yes.
Can I add that we also incorporate evidence-based practices for restorative justice practices? So evidence-based.
Well, so, and first, Vice Chair Carson Cottingham, you can correct me if I'm wrong. To my understanding, what we're seeing here is that we have the restorative practices that the district is implementing, and our work is then to learn more about the practices that the district is already implementing, and then receive updates on how they're implementing it across the district. And then, to Director Chandagiri's point, is also making sure that we update our policy based on that information.
And I think that the superintendent can correct me if I'm wrong, but I would hope that they are evidence-based restorative practices
Correct.
that are being implemented.
Yes, they are, and those would provide their own metrics and goals within the.
Yes.
So what Director Chandagiri is asking, it is built into there.
Yes.
Yeah. Let me clarify what I'm asking, because right now this discipline is with the district, not with the board. So if I understand right, we are still using the same old policy, but we don't have a separate policy which really takes into the elements of restorative practice, which we can look into the policy book. Parents can understand it, they can expect it, and they can monitor it as being implemented. Everybody is being trained in it. So we can look for consistency across 65 schools. Because if I open the policy book today of the district student handbook, it's the same old policy, not the restorative practice described. That's what I was hoping. That way parents can understand this is what will be expected if they choose to participate, or they choose to know what to expect before their kid goes into school.
So the request would be for the district to update their policies on discipline.
Correct.
Okay.
Again, Superintendent Perry, are those policies being updated to reflect evidence-based practices?
Yeah, we're doing this gradual evolution of policies, and you also need to remember that we've got a group out in the community that actually wants zero tolerance policies. So, which we don't have, but so we're trying to, as we get to a focus, as we get those implementation schools, remember it's implementation over time, that part of that is that policy change, and to embed that philosophy of discipline and a practice change in those schools as well. So, but keep in mind, we've got a group that wants zero tolerance as well.
So the monthly reporting on progress, well, not monthly reporting, but just update on progress would be also including the gradual changes to policy
Yep.
at the district
Yep.
level. Director Hyen?
Can you hear me?
Yes.
And so this may fit elsewhere, I'm not really sure, but I am looking forward to understanding really how restorative practices works with some real life examples. But are we tracking the results? Is it working? And this kind of probably maybe ties in with evidence-based. So these things, is it reducing certain actions that we don't want to happen? Can we show with data that it's having a positive effect on the student climate in the schools?
So I think that would probably tie us into the metrics and reporting of 3.1. Okay. So.
All right, we move on to
4.0.
Great. Okay, we obviously are running short on time, so if we can look at, let's look at these as a whole body of work. This is around board governance through policy updates and accountability structures, which I've heard every board member talk about many times. And so this is sort of the laundry list of things that we think need to be accomplished. And we understand that it's biting off maybe more than we can finish in a school year. So there's some that are a little bit later, like the last one you can see we go out till October 2023. But it would be reviewing all board policies and setting accountability for an annual review, finalizing board operating agreements and board superintendent operating agreement, developing reporting structure for the executive limitation reports, update results policy to reflect the monitoring of district KPIs aligned with the strategic plan goals and longitudinal state outcome measures, develop an agreed upon superintendent evaluation process, develop an onboarding process for new board members, strengthen the relationship with the Confederated Tribes of Grand Ronde and Confederated Tribes of Siletz Indians through government-to-government relationships to improve the achievement of our Native and Indigenous students, and then hold a board discussion on voting procedures for board elections. So this is sort of our board, core work in goal number 4. We're going to have small groups work on this to really pump out some of the changes with review cycles with other board members so that we can get through as much as we can. Director Hyen.
Can you hear me?
Yep. Yes.
Probably because I asked. If I don't ask, then you can't hear me. I think the list is great. I want to just point out, even though a former board cannot tell the current board what to do, that the former board did promise the community that we would look at zone versus at-large voting. And so I'm glad to see that this is on the list because, again, it was a promise to the community. And I think it's great. It's going to be a lot of work, but it's very comprehensive.
Yeah, that's absolutely why it is there, because of that. So thank you for pointing that out. It's super important to continue the work of the work the board did before we were elected.
Chair, thank you very much. In 4.7, it talks about strengthening a relationship. I was hoping we could call out implementation, full implementation of Senate Bill 13, which really talks about tribal history, shared history, curriculum, all the way from kindergarten to 12th grade incorporated. It's been 5 years. This consultation can continue, but there are already curriculum that is available from Select Tribe, for example. Maybe we can have a strategy and a goal saying that in the next 12 months or 24 months, we will have the curriculum incorporated, because this is very near and dear to me and to the community.
Yeah,
That would be a more tangible product, we can say.
Right. That's absolutely something that would go into the discussion around the development of the MOUs.
Okay.
So I know that's really important to you, important to me as well, and I think probably all board members. So we would want to make sure that we're having that government to government relationship built and the consultation on how we might go about doing that, and then be held accountable to the tribe and ourselves through that memorandum of understanding. Okay. So let's just keep that first and keep it in the front of our minds as we go into the negotiation process.
Can I just add that the responsibility also be shared with either the superintendent or the district? They will require that as they've stated it.
Yeah, absolutely. So perhaps we add that on responsibility, the superintendent.
And as a board, we may also want to consider separate budget allocation to purchase those curriculum, like what we did with DLI and training. So that means partly we'll have to call out specifically before the budget is made.
Okay, thank you. All right. Second Vice Chair Guzman Ortiz, do you want to lead us through 5?
Yes, that was incredibly a brief discussion for the goal with the most strategies. So looking, all right, so goal 5 for us is to equitably facilitate authentic engagement with parents, students, and community. Also go ahead and just read through the strategies here as identified. First is to host listening sessions in each high school feeder area. We've discussed listening sessions as a board, and I know that Director Daniel Bethel isn't here, and she has also brought this up several times. The second and with the work product there of scheduling events, the initial goal was to have those in October. I think that we might need to have some discussion on whether we have to pull that back a little bit. And strategy 5.2 would be to conduct stakeholder engagement for the district needs assessment. This has been ongoing work. Would take the district and board to do this, but the expectation is to have a final report by June 2023. And the last strategy on this goal would be to conduct community engagement related to the superintendent search, which we know we will be having a board session on October 4th, I believe. That will be our first session with the firm to discuss the first steps for that. And the engagement, the community engagement for that, the goal is to have that completed by November of this year as we go into that process. So any questions, discussion on this goal? Yes,
I had emailed all of you a document before this board to, just for the sake of time. I really think we need to call out authentic family engagement as a overarching goal. And I had put in something, a culture that engages every family, communicates effectively, develop relationship with every family, build family efficacy, engage every family in decision making and engage greater community. And also specifically mention, ensuring all families are welcomed and their safety and security needs are incorporated in the school environment. So we had a training in the Oregon School Board Association. I would suggest that if you could call out something like that and perhaps have Dr. Steve Constantino train our board and the district and the community, that would be a piece where we can at least come up with a common shared narrative of what does this mean by authentic family engagement. Okay. That was a very meaningful training personally for me, and it kind of made sense, and Chair Avila gave all of us a copy of that book. So that is one thing, it's so that we can start with, as a board, learn about that, like what we did with Dr. Brian Marks teaching us on implicit bias. The second thing is, once that could be called out, and then we can start thinking in terms of developing a goal statement, policies around it. At every level, think of involving family or a two-way communication so that we really start having a shared narrative to help our children, their safety, learning, etc. So I really think there is value in calling it out. That's the only way we can get that achievement gap of our children to close, the gaps to close, and every family will benefit, every child will benefit. So please consider that.
Yeah,
So-
I do want to state that the goal does read equitably facilitate authentic engagement, and we're stating parents, students, and community. And so definitely wanting to approach that with that authenticity, as you just stated. I do think that the first strategy and going out into the community and listening to families in the area is going to be our first approach, and we'll have to do that with lots of humility, right? Like, be there and listen, and I'm sure that we'll be able to have some follow-up discussions from that to see what are some of the priorities and what are some of those next steps. I see Director Hyen's hand, and then Director Avila.
Try again.
Almost. Let's try again.
It's because I didn't say that first, that you
Yep.
couldn't hear me, see? That's how it works. I said, thank you for the promotion. Making me a doctor, appreciate it. I don't know where this fits. Maybe it doesn't fit at all. I just wanted to kind of put it out there because we're talking about engagement with our families. And I hear from a lot of parents and even grandparents who are very interested in the curriculum that their students are learning from and having easy access to it. And I don't know, maybe like a tickler that this is an issue. I'm sure we'll hear from the community that it's an issue, that a lot of parents want to be able to see this information without having to go to the school and sit at a table while somebody's watching them.
Thank you. Any other thoughts, questions? Oh, yeah, go ahead.
Yeah, I'll just maybe a recommendation or more clarification. What is right now our family engagement? What are our strategies? How has the district been engaging? That makes it seem that we're not truly authentically engaging all communities. My understanding is our different communities are being engaged by our offices, by our parent advisory groups, and the information being gathered for the superintendent to make some of these decisions, and ours as well. have been included. So can we get an assessment or a clarification on what exactly piece is missing? I appreciate that.
So if I'm getting that correctly, I think I might hear two different buckets of work, because there's the board engaging with the community, and then there's the district engaging with the community.
Yes. Yes, and I think that's one of the pieces that in our goal, in our role, is engaging the board with the community, right? And so that's how we have to look at it. I know that, to your point, Director Avila, the district and principals are different schools have different approaches in how that family engagement might look within schools, but those do feel, again, like kind of two distinct pieces of work. And our goal within our role is to engage as a board. And
then just to include 5.2 as well, to see what kind of gaps there might be within the district's approach to help inform our approach.
So, thank you, Vice Chair, and thank you, Chair Avila, because understanding the gaps will help us, because obviously there are different perspectives in this. The way I see is board is ultimately responsible. You have delegated it to the district. And for a parent, they don't know the difference between district and the board. So for them, it has to be a seamless thing. So we can't simply say the district engages but board doesn't, or the board engages but district doesn't. Because at the end of the day, the rubber meets the road at the level of the classroom. So I agree with you, Chair Avila, that what are the gaps that is going on? The way I hear it, there is a lot of gaps. Some families don't know what they don't know. So there is a gap in terms of division of knowledge and understanding of how schools work or what don't work, what board does what thing. Second kind of thing is they don't get two-way communication. It may be there in the website. They can dig around and find out. And then a lot of people don't feel safe to come and ask a teacher. Some of us are culturally grew up not asking anything from authority figure or teachers. So there are a lot of challenges we are seeing which really yet every parent is worried about their child's safety and education. No parent will say, I don't want my child to do better than what I have done. So I see a big gap. There is a lot of families and a lot of parents are feeling left out. So I agree with Chair Avila what he said. First, to understand authentically what are the gaps. In a very honest way, if we can start looking at it, then maybe everybody can understand these are the things, because we can't be addressing this issue without complete understanding, and everybody should feel that their child is safe and they are learning. So I think there is a lot of work to do. That's my observation. Maybe I'm not completely correct, but that may be the case.
So as another addendum, maybe is there something that we could do in the workshopping of like 5.2 analysis of all feedback received? Maybe like a assessment of some kind in terms of the gaps that we're seeing?
There are, we could survey all the families. There are, in the training, but Dr. Steve, in the ODE training, they taught us about how to ask for authentic family engagement. There are ways in which it has been done, as Chair Avila said, evidence-based ways of surveying, getting assessment. So I'm not sure this may be a good time to tackle all that, in my opinion, and then let's make room for every perspective, not just one feeling left out.
Yeah,
To
well,
that-
and sorry, I was just pulling us back to like the actual strategy and how we like what we're asking for specifically, and if that would be a metric in this goal that we have.
To that point, a suggestion then, kind of maybe compiling what we're hearing, is to aside or in addition to the reporting back, after session, is a report with findings and perhaps key themes, and that would help us as a board respond, identify what is within our scope of work, and then what is the district, and to have that collaborative approach in responding to families. That would be the authentic engagement piece, right? That we listen, that we analyze, and that we respond. So does that sound like a reasonable approach then, to have a report? And I think we still have to have further discussion of who and how we approach that, but that we could have some follow-up for families and the community in terms of what we've heard.
Sounds right to me.
Yeah.
I'm just going to do a time check real quick. It's 8:42. We do want to end at 9. I know everybody's tired. This has been really awesome. I'm really excited about all of our goals. I do want to make sure we can run through the board operating agreements before we end tonight. So if we could just do maybe 3 more minutes on goal 5 to wrap it up. If everyone, any final, continue leading.
Yeah, we might be done. Any
Okay.
other hands?
Okay. And we will be, discussing with our contractor, Human Capital Enterprises, about how this engagement will look related to the superintendent search. And I like the idea of making sure we're utilizing that research brought forward and the professional and authentic engagement as we frame that and shape that with our consultant. So I'm excited about that. And maybe we could also just read and come back on some of those chapters of that book, since we all have it, from Chair Avila.
Maybe that's one of the metrics is,
Yeah,
we're a
that could
book
be
club.
yeah. Okay. Thank you. So next steps on our goals would be, if there's anything beyond what was shared tonight, I'll connect with Director Bethel. We will then, finesse, workshop, whatever word you want to use, so that we're incorporating all of the impressive conversation and into this document. My goal would be then that we approve the board goals next meeting, so that we can really make sure we're diving in, getting to the work part, and that this is our strategic set of goals for the school year. So please, if there's anything else, get that back to us as soon as possible so we can incorporate it. And then we'll recirculate it, and we will most likely have it as an agenda item for the October business meeting. Okay, pivoting to any questions about that before I move to the board operating agreement? I'm not seeing any. Okay, so if we can pull that one up again on screen now. Thank you very much. Okay, so these should look familiar. It's on different paper because we branded it for ourselves versus the Oregon School Board Association document, but it's been circulated. These were the roles and responsibilities that we worked on through 2 work sessions with the Oregon School Board Association, Vince Adams. And so these would be the roles and responsibilities. We definitely don't want to spend a lot of time wordsmithing. If there are big picture issues that need to be raised, or something that you're really feeling uncomfortable agreeing to, feel free to raise those. But I'll read through them real quick. So focusing first on the interest of children, the board will honor its trustee role in representing the needs of each child and their family in our district using equitable practices and governance. Focus on governance, observe governance policies and the board's fiduciary responsibility, cultivate a long-range vision for education through periodic strategic planning and annual goal setting, set expectations through policy making, adopt curriculum, and monitor district and superintendent performance. 3, the board and superintendent will participate annually in establishing goals and strategies for the board. The district will use these goals to focus the attention and effort of the governing body. And 4, annually conduct a self-assessment/evaluation. The board will improve its behavior and practice by yearly self-evaluation and by addressing itself to any individual problems through consultation and training and upholding the expectations in BG7 governing style. So anything on those first 4? Let's start there. Director Hyen. Can you scroll up to 1 through 4, please?
For me, I know we have our equity policy and everything, but I think there should be a period after the word family, because all children come first, and we have a role in representing the needs of all children and all families. And when we put the word equitable practices, I'm afraid we are saying one group before the other, which is not, is not right. They're all important. And I've been saying this all along. Every child is important. Every family is important. And so I take a exception with the last part of that sentence.
I'm not. Go ahead, Director Avila.
I would disagree on to that. It's not separating any one group over another. We're referring to equitable practices. And so it's being inclusive. That's making sure that all families are being served equitably.
Yeah, it definitely doesn't mean that all families are not being served. It means that some families we may need to focus as a district more on to achieve equity with all. Like, it's not saying that there's people losing out. It's that no one will lose out because we focus on people that may need more support to achieve the same thing.
So, for example, if a student is houseless, right, there is going to be more support for that student, making sure that they have transportation, that their basic needs are met, that we're connecting with families. That is where the equitable approach comes in. That student is going to have more needs than another in comparison. That's where the equitable approach comes in, and that we are working with students and families based on their particular needs.
Right, on their particular needs. You don't need to say equitable, which says different. You look at each child's needs and their family's needs. And they are all unique, and even the houseless students, all their needs are not necessarily the same. We need to look at people and families as the individuals that they are. And to me, when people read this, they're gonna think that we're putting certain people above other people, and we're not. We care about all of them, and we want the best for all of them, and we do our best to meet them where they're at or with what they need. It just, I don't know. It's just, it really concerns me.
Yeah, thank you, Director Hyen, for uplifting the definition of equity, of making sure that we're meeting people where they're at and assessing them based on their needs. Thank you so much.
Any other feedback on 1 through 4?
Yeah, I have a feedback.
Director Chandagiri.
This operating agreement is fine. I have no problems with having an operating agreement, but I'm seeing a real disconnect between what we are practicing and the operative agreement. The BG7 is a good example, right? So, we need to own up and honestly see what is going on between the board meetings, what we do, how we kind of answer questions, so that we can be fully informed and prepared by the time we come to the board meeting. And the challenge I am facing is I don't get answers to questions I ask or the emails I send. So mentally, I'm not able to understand the complete issue. When community members come and ask, I don't have answers to all the questions. That the more we kind of approach issue by avoiding it or not discussing it, as I like to call it, ghosting the families and parents and the fellow board members, it doesn't allow us to do this kind of robust homework. So there is absolutely, I have no problem in having an agreement. My only concern is we have to openly acknowledge where we are and where do we want to go from that. I don't think we have had an opportunity to even have that level of in-depth reflective discussion. So having an agreement like this It's like glossing over, painting over a problem internally we are struggling with. And I'm not able to get answers to most of the questions. I've asked repeatedly on, I don't want to go through all the issues that I have raised questions. I feel I don't get answers, or answers don't come back, or months go by, or sometimes openly the discussion has been curtailed. So I cannot understand how we can have a robust debate or discussion, different perspectives, especially in the community. There are multiple perspectives, not that one is right, one is wrong, but both will hold on. And we have to find a way to create space for that kind of different perspective. It looks like to me it's a rushed over thing that we are trying to get through this. We all want to achieve this. But
Director
we need to
Chandagiri,
acknowledge where we are.
I'm sorry. When you say things like that, it's incredibly harmful in the boardroom. And it's disappointing, and I can't allow it anymore. We spend an inordinate amount of time answering questions, all of us do. We spent an inordinate amount of time putting together these board operating agreements, as well as goals, strategies, looking through the data. So please do not make overarching broad statements that are not factual.
Okay.
Please.
Can I add to the fact too that when you stated that we wanted to picture where our board was and where we wanted to go, so we brought in Vince Adams to help us establish this board agreement, so that we can get to. We recognize we were we were fractured. We wanted to come together and having an effective and efficient board, operating under shared agreements that we all participated in with. So by completing this activity and agreeing to all these outcomes here that have been provided, would that not start to unify us to get us to an effective and efficient board? But your statements, as Chair Carson Cunningham just stated over and over, it really does harm. You continue to gaslight, and you continue to model behaviors that continue to fracture our communities. So it's really disappointing.
Okay, let me, please, I should have at least an opportunity to respond to this.
Go ahead.
I have specifically in between, with all due respect, I have sent questions. It's a matter of record. I sent questions asking for clarification with the true intention of understanding, so that I can go and help the community that's suffering, because there are sections of our community who are feeling completely disconnected. With that intention, I emailed questions. None of those questions have been answered by our board chair.
Are you emailing, so you're emailing me questions that I'm not answering?
I've emailed our board chairs and superintendent. So the only intention is I need to understand the issue, clarify it, so that I can at least find a way to explain or not to explain or whatever it is. So when the questions go unanswered, it leaves a void, Chair. I'm not trying to, because my intention is nothing other than we all work together, find a common space. But when we have such leave that complete blank answers or silence, how are we going to prevent us to function and go and clarify? Otherwise, people are going to fill in the blanks. And
Okay.
that is happening
Well,
in our
let's have a
community.
restorative conversation about that in private, which is what we're supposed to be doing per our policies.
it has not
instead
happened.
of you coming to the boardroom and airing it here all the time.
Chair, it has not happened at all.
That's not true. Okay. Let's move on to 5 through 8 to see if there is feedback so we can conclude on time. The work of the board will be conducted with care and respect. Board members strive to assume positive intent and will actively cultivate an environment where matters before the board can be discussed openly and collaboratively addressed. Own the collective decision-making process. Decisions of the board will be upheld, and the voice of all board members will be heard. Once a decision is made, board members will accept the decision of the majority, both in the boardroom and in the community. Board members will respect the institution of the board when voicing dissent. Practice efficient decision-making. Board meetings are for decision-making, action, and votes. The board agrees to move to the question when discussion is repetitive. The board will use work session meetings to allow board members to learn about and discuss important topics. And surprises at board meetings will be avoided. And board members will keep the chair and the superintendent aware of emergent topics. Requests for agenda items and for information requests that commit a significant amount of staff effort will be addressed to the chair. Board leadership will keep board members apprised of agenda planning. Any discussion on these 4 points? Director Hyen,
Testing.
we got you.
Yep.
I understand that the chair speaks for the board, and the chair probably should respond to people emailing the entire board, but just, so that you know, I will continue to respond to individual constituents because, that's part of my job, I feel. But I know I don't speak for the entire board.
Yeah, that makes sense as long as we are agreeing to respect the votes taken and decision made of the full board in our responses.
Yes, but I can say I dissented, but this is
Absolutely.
the decision of the board.
Yeah, absolutely.
So Chair, if I understand right from Director Hyen, as an individual board member, each one of us will retain our right to speak as an individual or individual board member, as long as we don't speak on behalf of the board, and we can discuss what was publicly voted and passed or any matter of public record. Is that correct?
Yeah.
Yeah,
That's always been the case.
but
Thank you.
you support the decisions of the board.
Okay.
It's a nuance that's hard, I think, because any one of us could disagree, right, and vote no. But you have to still support what the board has decided. Like, that's the hard part, right?
Well, it's not hard, it's very easy. I voted no on the policy on anti-racist inequity, but I will practice anti-racist practices and ask questions if there is disparity in certain community out of proportion to another community and why the resources are not allocated. It's not difficult. It's very easy to say this is the decision we passed. Since we are an anti-racist policy was passed, I will practice it. So it's not hard. It is just a matter of making sure that I want to clarify as an individual and individual board member, I do retain the ability to speak as an individual board director and
Yeah.
and practice exactly what we passed. Thank you.
Director
Madam
Hyen?
I generally agree with what you said. However, if it goes against my moral code, I can't. So an example would be if the board voted to put, they're not going to do this, right? But an abortion clinic in the school. That would go against my beliefs, and I would not be able to uphold that.
Well, I mean, there's a difference between like upholding it and just like agreeing with the general consensus of the board. We are taking a lot of time on this, but just in that specific instance, you can say, I mean, you of course are not going to go out and get an abortion, but this was the decision that the board made, and that is where we're at. So I think if there's nothing further, we can move on.
Okay, so 9 through 11, how the board communicates, recognize the role of the chair to speak for and about the board to the press and public groups. The chair responds to group emails sent to the board. Nevertheless, board members will be mindful that they oops, we're getting some feedback, sorry, that they represent the board in the public eye and that no individual board member has the authority to speak for the board, save for the chair. Board leadership will keep the board apprised of the logistical matters about meetings and upcoming topics. Board members will ask questions prior to meetings and will come prepared to fully participate. Board members will meet informally with one another should a misunderstanding or problem develop between them and strive for ongoing communication. So I believe that's it in its totality. I think we do want to finalize these operating agreements since we started this in the early summer, maybe even before school was out. We discussed all of this. Vince put it together. Here's where we are. They seem pretty standard, I think, for a school board based on the feedback we've received from some of the experts at OSBA. But if there's any other minor things that you'd like to change, edit, as always, just send them my way. And I will do my best to incorporate the feedback so that we can finalize them in October. Any final thoughts on that?
But you did take notes of what we already said, right?
But I can't.
Yeah, I know we can't hear you very well, Marty, but I think she asked if we took notes on what everyone was saying, and yes.
Can I?
So I don't have to email what I already said.
Yeah, she doesn't have to.
You don't, no,
Can I, before I forget, on number 11, I would ask that a member of board leadership facilitate that process.
What do you mean?
So board leadership can facilitate that meeting with the 2 or 3 individual board members who may have a disagreement to resolve it, almost as a mediator.
So a member of board leadership.
So that we don't have a quorum issue?
Yeah, and then
Okay.
actually conversations take place.
Okay,
There would still be resistance.
okay. Okay. Anything else for the good of the order? All right, thanks for staying a little bit late. We do have our next board meeting on October 4th, a special board meeting at 6 p.m., which is a work and planning session with Human Capital Enterprises regarding the superintendent search. We will call this meeting adjourned at 9:04. Thank you.